Good afternoon. Welcome to another telecast of ShiresHEALTH. I'm your host, Matt Harrington, with the Southwestern Vermont Chamber of Commerce. This telecast is provided by Catamount Access Television, so we thank our ongoing partners at CAT TV for their help in communicating these important messages to our community and region over the past 3 years that we've been doing this. So thank you to the team at CAT TV. Also joining me, as he often does, our good friend, Dr. Trey Dobson with the Southwestern Vermont Medical Center. He often provides sound judgment, provide reason, calmness during the storm. And so, Trey, always good to have you on here and good to see you again, my friend.
Great to be here. Thanks, Matt.
So let's hop into this. We've got a lot going on just in the couple weeks after Christmas and the holidays and New Year's. So we want to kind of reconnect with you, explore the new year, but really we're kind of in the trenches again. And I'm not sure we thought we'd be here in the third year, 2022, doing this, but here we are again.
Yeah.
Go ahead.
What we have going on is just, as everyone's aware, we have such a prevalence of the virus that now we're really at that part that you and I have been talking about for over a year. And that is where it's ubiquitous, it's everywhere, and we're developing that immunity, but it comes at a cost, and it's going to be a rough 30 days, but we'll talk about it.
Yeah, that's a good heads up for us. But let's start from the beginning, refresh our memory, and we feel like we do this every time we get together. But I think it's helpful for our community to remember kind of the solid advice you continue to give us. So give us a refresher on best pandemic practices.
Right. And actually, those vary a little bit about comparing to which stage of the pandemic we're in. So the current stage we're in is that there is so much community transmission going on. That tailors our whole risk profile. We do know, you said remind us, so what we've learned is that this virus is predominantly respiratory driven. There is very little spread through contact on doorknobs and other things. That doesn't mean, though, that that's not a good opportunity to clean those doorknobs, to clean your hands before you shake hands, because it's not just COVID, but there's other diseases that can be spread that way. And then it's recognizing that it's respiratory driven, therefore you have to distance, you have to mask. And frankly, right now, when the prevalence of the virus is so high, if you are a vulnerable adult, someone or a vulnerable person, by that I mean if you're over 65 or have medical conditions, you have to think about what you're doing over the next several weeks, because we're just seeing this huge surge in virus. You're going to need to avoid gatherings. And really, it's the right time right now to even avoid extended family till we get through this major incline, which will, of course, decline at some point.
Yeah, let's jump right to that. In the Bennington Banner yesterday, they continue to make these headlines, which to me it always just creates a little bit more chaos. But the headline yesterday was the number of cases just keeps climbing, 2,642. So why do we see these positive numbers? Didn't we all just get vaccinated? Didn't we get boosted? What is the linear kind of events and kind of impact of those events that we've seen in the last 30 days, kind of counting back to mid-December, the holidays, New Year, and then where are we today? And why do the numbers keep climbing for us in Vermont?
Yeah, so it's partially due to Omicron and the increased transmissivity. And it's also partially due to the fact that respiratory viruses spread from person to person. We are, as a people, as humans, we are very interactive with others. We're going to spread things, even if we have good protection, whether that's from prior disease or prior infection or from vaccination. And what we're seeing in those numbers are people who have symptoms. Sure, they're typically mild and they're vaccinated. Some people say they were moderate because they've been out for several days. And then lots of people who've been in contact with them that are asymptomatic, but they're going to test positive because they breathed in the virus. We have a lot of testing going on. I will tell you that if you test people on this show right now, some of them would turn out to be positive in the sense that they've got the virus replicating. Omicron does a really good job of replicating in the upper respiratory tract, so we detect it. But then if you're vaccinated or you've had a prior infection, then you're going to fight it before it gets into the lower respiratory tract or other parts of the body.
So we do have some questions that were sent in ahead of time. I do want to remind our audience on Facebook, please comment in the chat boxes below the video, and we will try and get to those questions. But we did have some questions sent in ahead of time, and I want to go, we'll kind of sprinkle them throughout our conversation here today, Dr. Dobson. One of the questions that was sent in is, are you seeing any difference so far clinically in the severity of Omicron and the previous variants?
So we're not really seeing much difference. And the reason that I can say that is from a scientific standpoint, what I see in the hospital is only a snapshot of what's going on in the community. What I can say is that our hospitalizations are increasing, but just like the rest of the country, and just like what you've heard about in London and South Africa, the hospitalization rate is not increasing as would be expected from previous pandemic surges. And that's either due to the Omicron itself being less invasive in the lower lungs, where you get pneumonias, where you get the things that cause respiratory depression and require hospitalization, or it's because we've got such good immunity from a high vaccination rate. Plus, many of us have seen the virus now at least a few times in our lives, whether we know that or not. And that builds up this immunity, which is, of course, antibody mediated, but also T cell mediated, which has a longer, memory and more difficult to measure. So I can say that from more of a scientific, from an anecdotal, it's really hard to tell. We can say that the literature is showing Omicron to be a little bit less invasive. We know, though, Matt, that the next 2 weeks is going to be rough because there's so many people being infected. That means that those that are unvaccinated get sick. Those that are vaccinated but have medical conditions like being older or have underlying illness, they end up coming into the hospital. Right now, we've got about 15 people in our hospital, and we expect that'll go above 20, maybe even above 30 at some point over the next 2 weeks.
Yeah, I want to dovetail a little bit from what you're saying, because the question that just kind of comes to my mind based off of that one is, and you and I have talked about this, and I just want you to kind of explain it to the audience again. One, are we living with COVID? I mean, like the flu, like even chicken pox, are we going to live with this? Is there ever going to be an end? And I think to that, and maybe you can get into variants, what's the probability we're going to see yet another variant? And for how long? Does the variants ever stop, or does this just kind of mutation continue to happen through our life?
Right. Well, let me start off, and I really do want to divide this up. And I say the next 30 days, that's the focus. That's what's going to be so difficult. What you're talking about is beyond that, spring, and then moving forward, and that's fun to talk about. It's an optimistic conversation, and you can see there's a lot of agreement out there among experts, as well as all the models and computer models. So I'll jump to that as long as you guarantee me we'll get back to the immediate concerns, because that's what I need the community to focus on right now, and the hospital staff are anxious about. So you've read all of the optimistic views of the fact that we are getting there, where we are going to reach this herd immunity. The phrase is not used as much anymore, but I'll use it again because it's actually very appropriate when we talk about infectious disease and pandemics, and the move from a pandemic to an endemic state. What we're seeing is Omicron has become highly transmissive. Greater than, this is unbelievable, but greater than 30, probably 50% of us by just the end of March will have been infected with Omicron. Now, when I say that, that doesn't mean they have COVID-19. COVID-19 is the disease that's having the symptoms. And lots of people can be infected with the virus, and especially if they're vaccinated, do not develop a disease, but they do develop even increased immunity, because the virus comes into their body, replicates a bit, and then gets tossed out by our immune system. So we're getting towards that endemic phase. It is very probable that other coronaviruses, there's 4 other coronaviruses that cause disease. They all cause common colds in humans. There's about 6 total, but 2 don't affect humans. But these 4, they probably came out with, and were very severe at the time they came out, and actually killed lots of people. There's a good study that shows that one of the coronaviruses around the turn of the century was called the Russian flu. You may have heard about this. And it killed lots of people, but then it eventually became endemic. People developed their immunity to it. And it looks like that's the exact same thing that's going to happen with SARS-CoV-2, the virus that causes COVID. And it looks like that's already starting to happen in certain parts of the world. And in the US, it's spread so fast, we should really see that. It won't be a magic switch. What it will mean is that healthy people, the virus will be a nuisance to them. It'll keep them out of work for a couple of days when they get sick, maybe every few years, and then they'll go about their lives just like they do with other colds and flus. Vulnerable people that are at the extremes of age, and people that have medical conditions, it is still going to be a cause of severe disease. It's still going to be a cause of mortality. The same thing is true with the flu. I know everyone's heard this, but the flu kills on average, and it's a big average, but about 100 people a day. So about 30,000 or more a year. And you don't hear about that much, but those people are dying because they have comorbidities. And if they didn't succumb to the flu, they were going to succumb to a bacterial pneumonia. They're going to succumb to something. COVID will be one of those diseases.
Yeah, some other phone call, Dr. Dobson, will talk about how do we compare to the Russian flu and the Spanish influenza. I'd love to hear about, are we doing any better with the modern medicines, or are we on track to kind of, if we went back in history and time, be able to see it took about 3 to 5 years, or maybe more back then and less now. So that's for another phone call. I do want to talk, what I have noticed just kind of anecdotally and watching and seeing is people are getting back into the purchasing of masks, super masks, super masks, and kind of debating between the cloth and versus N95. So talk to us a little bit about mask wearing. Is there a better mask to use when I go out, or am I in stores and restaurants? What do you wear, doctor?
All right. So this is all about risk. If we want zero risk, we don't go out. We don't need a mask because we stay in our home. And that is, unreasonable. And then on the other end would be you're so you don't care about it, you take risks, and you don't wear any mask. So that's an extreme that's right now not appropriate when this virus is so prevalent. And then it's the interim in between. So a poorly fitting cloth mask is on one side, and a well-fitting respirator, which is what an N95 is, a respirator, is on the other side. And you have to figure out for yourself where you fall in there. So you asked about me. So I wear a surgical mask that you can find in most every place. Here it is. This is what a surgical mask or a procedure mask is. It does not fit at the level of an N95. I'm also comfortable in where I go and what I do. I'm boosted, I'm healthy, and I don't have any vulnerable people living with me at home. And that is a reasonable decision for me. If I was much older, or if I had medical conditions and I still needed to go out, I would wear a respirator, which is an N95, and I would have that fit, and I make sure that it fits well. So when I say this, people want to know the answer. They don't want a choice, and I understand that. But I am telling you that there is some choice. There are some disadvantages to focusing so much on the mask and not focusing on other parts of your life and where your risk lies. So many people recommend an N95, and if that's what makes you more comfortable, it does decrease the risk.
Yeah, and it always reminds me, Dr. Dobson, we're also always having an ethics conversation on this show, and a sociology kind of experiment. And I always appreciate, as we mentioned in the beginning, kind of your calmness, your rationality, and that there is choice. And I often appreciate you saying, look, because of X, Y, and Z, I've chosen this. That doesn't mean you choose that, as much as maybe people want that direct answer. For those wearing cloth masks, here's a question that just comes up every now and then. How often should we replace it and or wash it? And this may just kind of be not just for COVID, but germs in general, and you're breathing on it. But how often, and how often should we replace even our surgical mask or N95?
Yeah, that's a great question. So on the cloth mask, let's talk about that. Look, it's not the beginning of the pandemic. You have more than one cloth mask. So there's actually no reason that you don't change your cloth mask as much as you change your underwear, right? So at least once a day, I hope, for people. And they may, you may say, why is it not effective anymore? And the truth is, no, it's probably effective, but it's getting soiled, it's getting wet, and it's just a good idea, a good hygiene way to take it inside and wash it just like you do your socks and your underwear, and use a fresh one each day. With the surgical masks, it's sort of the same thing. If you barely wore your surgical mask and you kept it in good condition, you could probably wear it for a week and it would still retain its efficacy. The truth is that I don't want to waste things. Believe me, I'm completely a green person, but I also don't want to use a mask that's frayed and not effective, because that's pointless. So the way I look at a surgical mask is you actually can visually look at it. And if the hairs or the fibers start to come up, you can actually feel that on your face. That's meaning it's losing its integrity. Most of the time, a mask really should be traded out every few days. By that, I mean every 2 to 3 days. A lot of people are going to say, wow, I've been using the same mask for 5 weeks. It's probably doing just fine, but it is losing its efficacy. If you can trade them out every 2 to 3 days. Now, if you don't use it, it doesn't need to be traded out. But if you're using it on a regular basis, then that's very reasonable. I will tell you that in a hospital setting, it's completely different because we're encountering patients, right? So we change those masks out much more frequently, and that's for a different reason.
Great. I do want to make sure we touch upon a couple things, and let's maybe take a little bit of a commercial break talk to us a little bit about the COVID Resource Center. I think it was closed this morning just due to the extreme temperatures, but can people still get vaccines? Can people still get boosted? And what does that look like from, at least from the hospital's perspective?
Absolutely. We work hard to get this COVID Resource Center operating to the best of our ability, recognizing that we didn't hire people in to go work up there. These are all people who are nurses and doctors and non-clinical staff who have other jobs. And so we do our best to staff it as many days a week and as many hours a week as we can. I know it's a little confusing because we sometimes have to change the hours. I hope everyone just bears with us. I will say we have one of the best testing and vaccine centers anywhere around, certainly in our state and in adjacent states. That being said, we always look for opportunities and we try to improve it. One of the things that we're working on right now is we know we're at the height of testing. We are getting over 750 people testing per day. And we'll talk about testing in a little bit. And that won't last once we get through this Omicron crunch here. But that's what we're seeing. And it's cold outside. It's very cold for our staff. We've purchased tents. We've tried to do it to the best of our ability. But we're going to need to move it inside. So we're going to be working to move it into the gym. That's a totally different operation and logistics and parking, but it's done around the country. That way it'll be much more comfortable for our staff. We'll be able to do the testing. A lot of it will be observed testing, where rather than me coming up and swabbing your nose, I'll actually hand it to you and observe you swabbing it. And then, you'll come in one door, you'll go out the other door. And we should be able to get the same volume of people, again, in a more comfortable environment for our staff. And then we'll have to figure out where we're going to be doing boosters and vaccines. We're still doing about 150 vaccines a day, which is fantastic. Most of those are boosters, but not all. Some are primary vaccines for people who have not yet been vaccinated against COVID. And we're so happy to see that. We know that will decline over time as everyone has been boosted, and we will work to make sure that we still have vaccine available. Of course, vaccine eventually will not be provided up there anymore when the demand is low enough and people that need vaccine can get it at their pharmacy or their doctor's office or other locations.
Do we have any numbers on children? Children was a sector that opened up right before the holidays, I think. Are we seeing that, much like the kind of the 86% throughout all of Vermont? Do we have a kind of microcosm that we can look at Bennington County and say the children in Bennington County are at what percentage of vaccination?
Yeah, well, I can see first off, Vermont compared to most states, we know that our vaccination rate is high. Our vaccination rate of children is also much higher than many parts of the country, which is a good thing. There is this sort of myth out there that since COVID doesn't affect kids as much, that they don't need to be vaccinated. That's just not true. If you're vaccinated, it decreases the time that you carry the virus and spread it to others. So you're vaccinating not only for your child's health, but you're also vaccinating to protect others in the household and protect their teachers. protect their loved ones and the people that are around them. So if we look at our teenage population in our area, it's actually quite high. It's about 50%, which is not where I'd like it to be, but it's certainly higher than in many parts of the country. And it declines a bit as you go towards the 5 to 11. But we are up above 30, and I believe maybe even 40%. Matt, I don't want to be quoted on these numbers because I haven't looked at them in several weeks, and I'd be curious to look and see where we are. I know that there are many kids out there that have been sort of waiting, and we are ready to give them the vaccine now that they can see it truly is safe and it truly is effective. I think you've read in the country about the significant increase in the unvaccinated children that are hospitalized now, and that's scary. These are healthy kids that are, for some reason, their body actually didn't do well with the virus, and it's preventable with vaccine.
Yeah. I do want to remind you, if you're watching on Facebook and you do have questions for Dr. Dobson, to put them in the comment bar, and our team at CAT TV and myself will be monitoring and trying to get to those questions. But I do want to head into testing, Dr. Dobson. We talked a little bit about it at the COVID Resource Center, but let's dive into some specific questions. We even had some questions sent in about testing, and as you said, it really has kind of skyrocketed since the holidays and the New Year, and to be expected. One of the questions is, when and how often should I get tested for COVID-19? Is it different for a PCR test and a self-test kit?
Right, and this question, I have to make sure everyone understands, because they're reading so much in the papers and the media, and advice actually is not standard. It's not consistent. It's a little bit all over the place. So testing recommendations do depend on where we are in the pandemic. So in other words, if we have very little virus out there, like in July of this past year, you should not test much, because the chances are, if you even tested positive, that it wouldn't be a true positive. And the same thing is true when we have such an amount of virus out there. Testing, surveillance testing, if you're not symptomatic, adds much less value than it does when the virus prevalence isn't so high. It's hard for people to understand that, but let me explain a few things. If you were in close contact with someone right now, and I tested you, your chances of being positive, let's just say, are pretty high. But so is the guy on the street who wasn't close to me. In other words, the virus is everywhere in that regard. I think testing provides some people with some comfort, and they want to know whether or not they have the virus, and that's important. Unfortunately, it's very difficult to come by right now, as we all know, and at some point we'll catch up with the testing supplies in the country. By the time we catch up, we probably won't need to test as much. That's just how these things work. Let me just talk a little bit about the differences in all the testing, because it's very confusing. We're putting a lot of information up on our website this afternoon. In fact, in a really simplified way. If you search the internet, it's actually hard to find simplified algorithms on what the tests mean and when you should do them and how you should do them. So let's talk about the home kits, the antigen kits. Most of the public has educated themselves very well, and they know that the antigen kits are very useful, that they are rapid, and that they're not quite as sensitive as the PCR tests for picking up the virus. And is that okay or not? Well, it turns out if you have symptoms and you do an antigen test and it's positive, then that's really good information. You do not need to test anymore. If you are symptomatic and you do an antigen test and it's negative, then you need to go either up to our COVID Resource Center or some other medical practice where you can get a molecular test, a PCR test, because it is true that early in your symptoms, you may test negative on antigen, but you'll test positive on PCR. So then people say, well, why do I even bother with the antigen testing? Well, again, if you tested positive and you were symptomatic, you know that you have it, and you don't need to bother going and getting a PCR test in that regard. Now, it's the asymptomatic. It's these people that need to test either for their own concern or because they are heading to work and their work is requiring it, or they're heading for travel. And this one's a little more complicated. In general, we say that if you take an antigen test in those situations and it's negative, then we feel pretty good that you don't have virus at a level that is transmissible at that moment. In other words, you could have a little bit of virus, but it's not transmissible, then you need to test regularly in that regard, or you may miss an infection. And let me just show you what we're putting up on our website. I'm going to pull this up so that you can see. This is right here, testing in an asymptomatic individual. So can you see that, Matt?
Yes. Yep.
All right. So this looks a little complicated, but heck, it is complicated. So I tried to make it into the most simple sort of algorithm. Again, you can go to our website, and we will have this up tonight, and say, look, if I'm asymptomatic here, and I'm going to get a test, what test do I need to get? Well, you can get either. You can get a PCR, which of course has the disadvantage of having to drive somewhere, wait in line potentially, and then wait 24 hours for the results. Or you can get an antigen test, and if you happen to be able to get an antigen test that you've purchased at a supermarket, or it's been sent to you through some type of state program, then you can follow this algorithm and see, I'm asymptomatic, I've got a positive test. What does that mean for antigen? Then it means I can repeat it once, or I can get a PCR and be done with it. If it's negative, then I effectively excluded COVID, and I can go about my life. But again, the antigen test is really only as good as right now, and there's no telling what could happen to you the next day. You could be exposed to the virus, or you could turn positive because you had a small amount of virus within you. So it is complicated. I wouldn't overthink it. I'm not a big fan of surveillance testing. In other words, just testing for the heck of it if you're asymptomatic. And the reason is because it's everywhere. The virus is really everywhere. If 50% of the people are going to be infected by the end of March, then we know it's everywhere. And just testing just to test is probably not adding much value.
And for those people, I mean, I think you were kind of poking around it, but for the next 30 days, if we don't have to go out, if we can limit our socialization, unlike what we were saying around, I think, Thanksgiving and the holidays, get in small groups, be as best you can. What I'm hearing from you now, doctor, is, hey, for the next 30 days, leave it to getting the essentials, and that's about it. And let's kind of get over the hump here. Is that what I'm hearing?
Well, let me clarify that a bit. I'm actually talking about the next 30 days is so important for our healthcare system. I think everyone knows that as of 2 days ago, about 36 hours ago, the number of hospitalizations in this country exceeded the highest point it has been in the pandemic. And the modeling shows that it's going to go up much higher. And I'm going to tell you, we can't absorb that. We cannot, there's a finite amount of resources. There's a finite amount of nurses and doctors and laboratory techs and radiology techs. There is a finite amount of equipment and drugs that we can use, and we really could overwhelm the healthcare system. So there are two things that I'm asking, and I'd hope that everyone would do. The first is being boosted. If you're being boosted, yes, you can still contract the virus. You can still spread the virus a bit, although at a much lower rate than someone who's not boosted or not vaccinated. But the most important thing is you are very unlikely to wind up in the hospital unless, again, you're at the extremes of age. If we look at ICU admissions in our system in Vermont, nearly 90% of those people are unvaccinated individuals that wind up in the ICU. And in the hospital, 75% of those that are admitted for COVID-19 are unvaccinated. If we could take out those groups, if they could get boosted, then we would be able to weather this storm, keep our nurses and doctors from being overrun and keep our health systems going. The second thing that's really important, and this is where I want to differentiate, if you're young and healthy right now, when I say young and healthy, if you are not at high risk for severe disease, I guess young and healthy means different things to different people, but it is okay and it is appropriate to be functioning in society right now, wearing a mask indoors, only gathering in small groups, going out on a run, going out and participating in your sports. But if you're vulnerable, if you're a grandparent right now, now is the time to avoid the extended family for a few weeks. Just get us through this month, maybe the first week of February. And I know it's been a long pandemic. Most people have started visiting again. You just need to hold off until we can get through this situation.
Yeah, I know we have a question that came up, and I want to circle back around it, Dr. Dobson. It really does get to, I think, the crux and the meat of what you've often encouraged this community of Bennington and beyond. The question basically focuses around, shouldn't we do everything possible within reason to avoid infecting others and ourselves? Why wouldn't we be encouraging people to use surgical N95 mask indoor public areas? We can't all stay home. We know that masking, when done correctly and by all parties, is helpful to reduce the spread. And I'll tee you up a little bit by saying I think we go back to that choice, comfortability. And you often remind us that, look, if we become so uncomfortable with this, it doesn't become a habit. It becomes, a discomfort, and we stop doing it. So just expand upon what we've already kind of talked about at the show around choice and comfort.
Right. Well, yeah, I will go back to that, and I applaud that question, and I applaud people that want to do everything they can. I want to do everything I can too, but there is a reasonable amount, and there is also a diminishing level of return for every action we do. So if we really want to prevent people from being infected, then we would, not leave our homes. Okay, so that's an extreme amount. If we want to do something that's highly effective, look. A surgical mask is highly effective, and I'm talking about I maintain distance. I go to select places. I don't go to indoor concerts, and again, I don't live with people that are vulnerable. When I'm at work, I'm fully PPE'd. It's a whole different level when I'm seeing patients in the hospital. And so for those who are vulnerable or live with people that are vulnerable, immunocompromised, then they should do as much as they can to feel comfortable in that arena. And I also understand, does this sound like, why are you telling one group to wear an N95 and another group to wear a surgical mask? I'm actually not telling you anything. I'm telling you that a surgical mask is highly effective. It's not as effective as an N95, but these are all risk choices that you make, and you come up with something that's pretty strong and will limit disease. You can make analogies all you want. If driving 55 is a certain risk and you're trying to minimize it, then you should drive 45 or you should drive 35. I mean, there are some levels where it doesn't make as much of an impact. And so wearing an N95 is perfectly reasonable, perfectly appropriate. I'm very comfortable wearing a procedure mask. Again, I distance from people and I'm actually not out that much to begin with.
Great. Let's get back to testing a little bit. So we've talked about the PCR and the other, and so where can I get tested? Where can I pick this up? We had mentioned possibly, you order it online, you get it from the federal government, you go to your pharmacy, where obviously the CCR, or CRC, where can we best pick it up and get tested, and if we need to?
Yeah, gosh, this changes day to day. You read in the newspaper, there are some state programs that are going to be handing out antigen kits. Right now, some of those kits are being slated for the school system, so they can be given to students who are exposed and want to keep them in the classroom. Sometimes CVS gets them in, or Walgreens, or Walmart, or many other places. I don't want to, say a particular name of a retail outlet. I have no preference where you get these tests, and so you just have to keep at it. And then you have to figure out why you're testing. So if you're symptomatic, that's a good reason to test. If you're asymptomatic and you're just concerned, you have to think, if the resources aren't there, then it's probably okay to not test and continue to do mitigation measures. If you need to go somewhere and you can't find an antigen test, then go get a molecular test. It's more sensitive anyway. But we do see people that are very anxious and test very frequently, and I don't believe that's adding value to themselves nor to the community, because the virus is everywhere. You may just not catch it in between times you've breathed it in for a few days and it's gone.
Okay. We did have a question sent in a little bit earlier. Are two antigen tests 24 hours apart a reliable measure for return to work or school, or should PCR be the first choice? I mean, we've kind of talked about it, but let's answer.
Actually, either one of those are good choices. Two antigen tests to return. You're talking about after someone has developed COVID-19 or after they've been exposed. So two antigen tests are perfectly reasonable. And then a PCR is perfectly reasonable. If you are asymptomatic and you have a negative PCR, your likelihood of having COVID is extremely low. With an antigen, it's also low, but it's probably around, I'll put some numbers on it just for the audience, probably as much as 10% can be missed. And so repeating another antigen 24 hours later is going to cut that number way, way down.
Right. Let's revisit vaccinations a little bit. We were looking at the Department of Health vaccine dashboard, and we've mentioned the 86%. Dr. Dobson, isn't that heard? I mean, we are close to 90%, which used to be an A on a test when I would take it. So why at 86% are we still such high numbers? What does that mean to us?
Yeah, I'll reverse it and say we're actually doing really well because the numbers of very sick people is low. The problem is the virus has all come at once. Omicron has just come at us at once. So it means that all these people are getting infected all at once, and some of those people are not vaccinated. So even if we have an 86% vaccination rate, that's still lots of people who are unvaccinated. And I know that because I see them in the hospital. That's what happens. And then, of course, again, you have vulnerable people, though, that even though they're vaccinated, they can become sick from COVID and then other things. So what we've had is this all of a sudden really sharp peak. That means people getting infected at once. And that's why we're seeing so many positive tests.
Great, thank you. And here's a little bit of a side question, but I thought it was interesting and it was sent in as well. How much exercise do COVID patients get while in the hospital? Could getting more directed exercise improve their long-term symptoms? And we can kind of dovetail into long COVID as well, if you would.
Oh, sure. As far as someone being in the hospital with COVID, first off, they're pretty deconditioned to begin with, and they're trying to save all their reserve to focusing on their ability to exchange air in their lungs. So exercise-wise, most people in the hospital, in fact, anyone in the hospital with COVID is not in the mindset of going on a run or walking on a treadmill. They're more sick than that. We do have physical therapy, though, that comes in, and we also have something called pulmonary therapy, where people come in and they work on their chest, they work on that air exchange. Right in the throes of being so sick that you're hospitalized and in bed, it's hard to imagine, pure exercise, but they definitely do these breathing exercises where they blow into a spirometer and try to achieve a certain amount of positive pressure coming out of their lungs. Which is a very good thing. It is true if you are just lying there and not active, you can develop pneumonia and other respiratory problems.
I know you're a fitness guy as well. Is there any science, and maybe just with the common cold as well and viruses, to making sure that we get daily exercise, making sure that we're in peak condition will at least kind of help, obviously, our antibodies and so on and so forth. So from that perspective, what's kind of your philosophy or theory on getting, both the balanced diet, but also exercise as well?
Yeah, that's actually something I'll just elaborate on with Omicron and other things. If you're in good shape, in good physical fitness, you still are pretty vulnerable to upper airway disease. In other words, a virus that causes problems with your throat and with your nose and your upper lungs to get a cough. But you really protect your lower lungs. You protect from pneumonia. If you're not physically fit, if you're not in shape, your lower lungs are at much more of a risk. And that's why we see folks that are deconditioned and being admitted to the hospital at a higher rate. And that's what Omicron is not as good at infecting those lower lungs. But if you're not in shape, it still will affect you for sure.
Great. And to kind of piggyback on that immunity, and I think I've asked this question before, but I want to circle back to it in one way. As we stay inside, as you kind of encourage us for the next 30 days and perhaps work remotely, and we know that the kids are being kind of doing this hybrid winter model again at school, as we kind of ebb and flow and wear masks, what happens to our basic immunity, to other viruses and diseases? And I think we probably had this conversation last winter, as we're kind of inside breathing the same air and we're not introduced to things that our bodies can kind of fight and gain greater immunity. Do we have any disadvantage to kind of being inside, wearing masks, being super clean? Anything around that?
Yeah, not an immeasurable amount.
Okay.
We're still being exposed to plenty. And I will say, I don't know if this is where you're going, but we're not seeing much flu right now, and that has to do with our high use of masks. There are parts of the country that are seeing lots of flu. It likely will increase because flu peaks in the February-March timeframe. But the good news is we're not seeing that double whammy of COVID flu right now, which keeps people out of the hospital.
Yeah, and we seem to keep seeing that each winter, and you and I comment on it. And I'm sure it's a combination of, as you said in the beginning of the show, cleaning surfaces probably has a high unlikelihood that it's doing anything to COVID, but it's still a good practice to do. Wearing masks in general, I think I'm pretty much committed to probably forever in the winter wearing a mask if I go grocery shopping or anywhere inside, whether there's COVID or not. So we do see that happening where, and it's kind of basic science, right? The more precaution we take, the less we're spreading of any type of disease.
That's right. I'll also use this opportunity to switch gears a bit and just talk about how we can live with this virus a bit, not only over the next 30 days, but over the next few years. We have to be careful. We all want to, or at least most of us, want to minimize the effects of this virus on others and the vulnerable population. We have to be careful not to judge. We have to be careful to understand that, some of us need certain things that others don't. And if we really just, hole up in our homes and don't get out, because we're so worried, that actually has tremendous negative effects on our emotional state, our wellness, our ability to interact with others. So finding that balance where you are reasonably protecting yourself and others, and also getting out and being active and engaged is very important. And that definition does not have to be exact. Yours can vary from mine a little bit, as long as we're all within a somewhat narrow area of understanding what we're trying to achieve here.
Yeah, let's pause there, Doctor. I think it's an important thing to know, and I want to kind of connect it to how the hospital is doing, how the staff is doing. But obviously, mental illness and mental depression, I think it may be more anecdotal, but I haven't seen any statistics. But obviously, therapy and psychologists and psychotherapists are at their max too, because they're seeing so many patients now. And I think that's pretty much countrywide. Talk to us a little bit about mental health in general, what we can do to kind of create a healthy mind as well and a healthy spirit. But also talk to us a little bit about how the staff is doing and how the building's doing up there at the hospital.
Sure. Well, what we can all do is we can all recognize that the situation is incredibly stressful, and not say it's more stressful for me or my profession than it is for yours. It is different. So I'll tell you, in healthcare, one of the biggest stressors we have is we can't turn off the spigot. We can't say we're going to close the business for a half day today due to staff absences or due to concern on illness. We have to stay open, and that's very stressful. But on the other hand, teachers have different stress. Those in the food service industry have different stress. Heck, people that work at home exclusively, they have a different stress from this pandemic, and none of it's good. So making sure that we're not, trying to put a weight towards exactly what the pandemic has done to your particular profession is important. Second, the things that we can be doing, interacting with others is very important. And again, I'm not talking about going to a rave in downtown Albany. That's not safe to do right now. We all know that. But interacting with our friends, having vaccinated people over for dinner, even during this time right now, as long as they are not vulnerable adults who should be avoiding those things right now, it is important to do this, and there will be some spread of the virus from those types of activities, but it's so ubiquitous. There is a risk-benefit ratio there, and it depends on you and how much activity you need and interaction, but those are important. And then finally, as you said, exercise. Not only exercise to stay healthy, so that if you do get infected with any type of illness, that you're in better condition, but exercise because it helps your mind, it helps your outlook on life. It helps your well-being. As far as the staff at the hospital, they hear me talk, and I talk about the future and what's going on with the virus, but none of that really matters right this moment. What they are concerned about is, can we take care of the folks that are presenting to us today, tomorrow, and for the next 2 weeks. And we're nervous about that. We're nervous about having the resources and the staff and the stamina to do it. So please support them if you see them. Please let them know how much that their work means. Let's get through these next few weeks, and then we can focus on the spring and how we are going to behave and enjoy the spring with the virus in a decline.
Yeah. If we already didn't want to get out of a Vermont winter, this makes it also better to hit spring and summer and really enjoy those warmer months. I will mention that, and it hasn't been launched yet, but I know that the chamber is working with the hospital for another meal train for staff as well. So stay tuned. Go to the website swvtchamber.com. Go to the hospital's website. We'll have more information up in the next couple of weeks. And again, that's just the community giving back to the hospital staff that has been there. Gosh, 3 years fighting the good fight. And so we want to make sure that you guys feel appreciated by your own community. So thank you. In the news this morning, and we'll kind of wrap up as we get to the 1 o'clock hour. If you do have any final questions for Dr. Dobson, please put a comment in the Facebook. We'll get to it, and we'll probably be back with Dr. Dobson before this is all over. So if you didn't get to a question today, make sure you send it to one of us, and we'll get it on the show next time. But in the news this morning, Pfizer announced that it would develop. It looks like it's developing a vaccine for Omicron. What do we know about this? Anything that you've heard, Dr. Dobson?
Yeah, I've heard a little bit. We do know that we should be able to tailor vaccines pretty quickly towards different variants. Omicron has a different protein structure, the spike proteins on the outside, making the vaccine a little bit less able to latch onto it. But there's other parts about Omicron that make it a little bit more likely to infect you, even if you're vaccinated. But remember, that's just for the initial infection for a few days and symptoms. The vaccine is still working nearly the exact same at keeping people out of the hospital and keeping people from being very sick. And no matter how many vaccines we make, it is unlikely that we'll ever prevent the virus from being able to give you a small infection. I mean, that's just how infectious disease works. It's not a plastic covering over your face. It is a virus that goes into your body, and then the vaccine recognizes it and starts neutralizing it, but not before it causes some symptoms or at least replicates some. So it is true, Pfizer should be able to tailor a vaccine to Omicron. I'm going to tell you, I'm not even so sure we're going to need it, because the virus is going to become so prevalent, or it is becoming so prevalent, then it's going to drop off from our exposure and our previous vaccination. I think the good news is that they are ready. All of these industries are ready to tailor vaccines should another type of variant come out that needs specific vaccine. We didn't talk about treatments. Let me do 2 minutes on treatments real quick.
Please do.
Everyone knows that there's some treatments out there that are unfortunately under very much of a supply constraint right now, but that won't be the case in just a matter of 6 to 8 weeks. We should have a good supply of the oral Paxlovid, which is an oral antiviral that has been shown to be highly effective against the virus to help those that are at high risk. So this drug is not meant, at least not right now, it's not meant for someone who's young and healthy, because the chances of them having severe COVID is extremely low. I mean, it's very low. But the chances that someone who's, 65 is not old, but at 65, you are at an increased risk, and this medication would be for you. So you test positive, and you take this medication, and in addition to the fact that you're vaccinated, that really should prevent you from getting ill. Right now, it's amazing. We're getting very small amounts of the pills. Something like 120 courses in the state of Vermont were received last week. I mean, that'll go away in a matter of 10 minutes. I think Bennington received 20 courses. When I say courses, that's enough medicine for 5 days of treatment. But that won't be the case in 8 weeks, 12 weeks. We will have a lot more of the drug, and we can give it out. And then, of course, there's the intravenous drug, same thing, sotrovimab. It has a different mechanism of action. It's a monoclonal antibody. When I say same thing, I mean it's in very short supply. We get in about 10 to 12 doses a week, and we use them up right away. But they do prevent people from being hospitalized who are at high risk.
Yeah, let's. I want to continue with that treatment theme. So I actually have had some friends who have gotten it, obviously, pretty likely, and have stayed home in quarantine for 2 weeks, almost in their own kind of section of the house. What are some of the symptoms that a healthy adult who got COVID, who has to stay home? One, they're maybe asymptomatic but have it, but B, they may also get a little sick. So, what are some things we should be prepared for? And then B, is it chicken soup and Gatorade that we're trying? What do we do to get even healthy? Are we treating it like a flu? What does that look like from a home remedy?
We really are. Most folks that are vaccinated, that are healthy, they get COVID, they actually don't get as bad as symptoms as the flu. I don't know if you've ever had the flu. I've had the flu probably twice in my life, and I thought I was going to die. It's awful, right? But people can get pretty sick with COVID that are healthy and vaccinated. They typically report that they're tired for sometimes 7 to 10 days. When I say tired, they just don't have any energy. They have a bad sore throat, a headache for a couple of days, and a fever. And so that's all supportive care, right? It's just being comfortable. It's having someone else hopefully take food to you. You're bored because you're isolated. If you feel like getting up and walking around, even going on a walk outside, you should do that. If you're short of breath or your coughing is making you real short of breath, then that means you've sort of moved on to sort of a moderate portion of the illness. And in that situation, you need to watch yourself, make sure you're not getting too short of breath, and maybe limit your activity.
Great. All right. In our final moments here, Dr. Dobson, let's just do a kind of a recap, tips for the winter. Do's and don'ts. What should we be doing? What shouldn't we be doing?
Well, for the next 2 weeks, if you're vulnerable, you should really be at home as much as possible, having someone else deliver food to you. What you should be doing is getting boosted if you're not. If your neighbor's not boosted, try to encourage them in a non-judgmental way to get boosted so that we can keep people out of the hospital. And then the rest is all about your mental health and your well-being, your physical well-being. So don't be afraid to go out, but wear a mask right now because the virus is too prevalent. When the virus drops in prevalence, you can ditch your mask except under certain circumstances like maybe traveling or visiting places like hospitals and things. You'll have to keep a mask on because you'll always be around vulnerable people.
Great. Dr. Dobson, thank you so much for taking time out of your busy day. Thank you, Southwestern Vermont Medical Center, for continuing to be just this kind of star on the hill, star in Vermont in terms of your care and attention to the COVID pandemic. Thank you, audience, for tuning in. I know it's a busy Tuesday. Here we are in the beginning of the new year, but really important and really glad you joined us this afternoon as we talk to Dr. Dobson. And finally, thank you to our friends at Catamount Access Television for their continued broadcast of our series, Shires Health. Well, I'm sure we'll be back in a couple weeks when Dr. Dobson has some more information for us. Thank you and have a great Tuesday afternoon. Thank you.
Thank you, Matt.